Now in health news, in today's West Michigan Moves segment, the remedy for back pain used to be rest, rest, and more rest. But new guidelines say the key to beating back pain is in staying active.
Yeah, Dr. Christopher Eyke, orthopedic surgeon with Orthopaedic Associates of Muskegon and member of the Mercy Health orthopedic team, has more on the importance of staying active to both prevent and treat that back pain.
I'm an orthopedic spine surgeon. My specialty is surgical treatment of spinal disorders, but I also treat a lot of people non-operatively as well. The process of an evaluation for back pain usually starts with a visit to the doctor's office, at which time a thorough history and physical examination should be performed. And then based on the history and the physical exam findings, other imaging studies may be ordered. And from there, most of the time we treat these issues with physical therapy, short-term use of pain medications, anti-inflammatories, short terms of bed rest. Sometimes spinal injections can be very helpful, and in rare cases people will go on to have an operation. Most patients, in fact 4 out of 5 patients, will experience some type of back pain in their lifetime. The causes can be very minor, such as a gardening incident, leaning over to pick something up. There may be no antecedent event, or it could be something more serious, such as a motor vehicle accident or a fall from height. The good news is that most of the benign back pain, though it's not associated with any trauma or other worrisome symptoms, will resolve generally spontaneously within 6 to 12 weeks, and about 90% of people will have resolution of their symptoms without any specific treatment. The symptoms can be a dull ache, sharp pain, shooting pain. In the past, the treatment for attacks of acute low back pain were typically rest, bed rest, not moving around, but generally we limit the resting to just a few days. And after that, encouraging people to be up and as active as they can be. Laying in bed is not good for the body. It causes stiffness and soreness and has not been shown to have any improvement in the treatment of low back pain and the results of a resolution of the pain. In taking a history, we look for the so-called red flags, and the red flags would be things like fever, weight loss, constitutional symptoms including nausea and vomiting, numbness, tingling, or pain radiating to the extremities, or weakness in the extremities. Other concerns would be pain that's been unremitting for 6 weeks or more, or that associated with a major trauma, such as a fall from a height or a motor vehicle accident. Generally, it's recommended if there's no significant trauma and in the absence of red flags, there's no need to do any imaging for up to 6 weeks. After 6 weeks, if the pain is unremitting, or before 6 weeks, if it's associated with those red flags, then we generally undertake more imaging studies. I tell my patients a very simple rule that if it's good for you, it's good for your back, and if it's bad for you, it's generally bad for your back. Nicotine use, particularly smoking, but all nicotine use can accelerate the normal age-related degenerative changes that your body undergoes or your spine undergoes. Maintaining a healthy weight is important. Carrying around an extra, 20, 30, 40, or 50 pounds may not be the ultimate cause of your problem, but it's certainly not helping it. First of all, don't despair too much. Generally, back pain is a benign, self-limiting condition, and it will usually resolve either on its own or with some very minor interventions. Most people don't need an operation. Surgery is generally reserved for those people who have the red flags.
And for more information, head to mercyhealthorthopedics.com. Also remember to check out all of our West Michigan Move stories. Just head to Facebook and type in the keyword West Michigan Move.